Dr. Danielle Martin has been named one of Canada's most powerful doctors by the Medical Post, and today she is on a mission to fix the problems within the Canadian healthcare system. Martin has just released her book, Better Now, that outlines her 6 big ideas to help bolster Medicare in this country. She joins us on this morning to talk about a few of those ideas. Good morning to you, Doctor.
Good morning.
As Canadians, we're very proud of our healthcare system, but it is not without its flaws. You wrote this book to try and change the conversations that Canadians have around their healthcare system. So what conversations are you tired of hearing of, and what do you want to see changed?
Well, I'm a family doctor working in the system every day, so I see the challenges and the cracks that my patients experience as they work their way through the system. But I think we've been stuck in a conversation about, is the system good or is it bad? You know, is Medicare worth preserving or do we just get rid of it? And I think that has stopped us from being able to really focus on the conversation we should be having, which is, how do we make it better? Because we know that there are a lot of concrete things that we could be doing to improve people's health, to improve their experience as they navigate their way through the system, and to make the system more sustainable so that we'll be able to keep it for our kids. And I think that that's the conversation that we should be having, and that's what I'm trying to do with the book.
I think you've hit on a great point about the experience, because I think in theory we like the idea of our Medicare system, but you're right, the experience that we have going through it, not always great. Access to a family doctor is a place where a lot of Canadians get stuck. We know the importance. We're told it all the time. It makes sense to us, but access is not always easy. What's your solution?
Well, you know, most Canadians actually will report that they have a family doctor or a primary care provider who they consider to be their sort of person, but they often have a difficult time getting in and getting an appointment when they need it in a timely way. And so we've seen the rise, for example, in places like Toronto, of the walk-in clinic, where people are getting, convenient access to care, but not necessarily the kind of relationship-based healthcare that we know is really the best thing for our health, and that allows you to have an investment in a connection with someone who's going to be able to help you navigate the healthcare system over time. So in the book, I talk about what that relationship-based healthcare looks like and what we need to do to achieve it. The other thing is that we need to build better relationships between the family doctor's office and the rest of the healthcare system. I was in my office yesterday and I discovered that a patient of mine had been admitted to the hospital who had a heart attack in a hospital just a couple of blocks away from my office. But she had already been discharged and gone home, and I had no idea that she had ever been in the hospital. So we need to improve that communication between different parts of the healthcare system in order to make sure that the service is more seamless.
You make a good point in the book, too, about there are other forms of primary healthcare providers, nurse practitioners, nurses, but funding doesn't always match that. So in Ontario, for example, doctors can bill OHIP, nurse practitioners can't always bill them directly.
Right, and I think, you know, one of the things that's really important for us to know is, in a situation where we have waits in the Canadian healthcare system, team-based care, where we're bringing in other kinds of providers and allowing them to work to the full scope of what they're capable of doing, can really increase the access that people have to the healthcare system. You don't always need to see a doctor, and in fact, sometimes the doctor's not the best person for you to see. We need to make sure that people have access to service from nurses, nurse practitioners, dietitians, physiotherapists, that wider range of health providers, which can improve access, reduce wait times, and also cost the system less overall.
You say unnecessary tests and interventions are clogging up the system. What kind of tests and interventions are you talking about?
Well, we know, for example, that almost 1 in 3 medical imaging procedures, whether it's X-ray, MRI, CT, ultrasound, contributes no useful information to the management of that person's
What about the
case.
peace of mind that it offers a patient?
Well, what we don't talk about is that what's the price of that peace of mind in terms of the risk of harm to the individual. So I talk in the book about a patient who had an unnecessary stress test and ended up, through a series of events, having an angiogram and unfortunately having a stroke as a complication of that angiogram. So, you know, CT scans cause radiation, and radiation has risks to it too. So when we know that an intervention or a test is going to help the patient, of course we should do it, and everyone should have access to it. That's the principle of fairness that underpins the Canadian healthcare system. But if it's not going to improve your health, or perhaps even could harm you, we shouldn't be doing it. And if we're able to reduce those unnecessary and harmful tests and procedures, we would also free up a lot of resources.
We talk a lot about wait times in this country. What is your solution for wait times? We just recently learned that, in 2016, they are the longest that they've ever been.
Well, in some places, they've actually gotten a lot better, and in some places, they continue to be long. I think the good thing about wait times in the Canadian healthcare system, and I see this as someone working in the system, they're not a problem when the situation is dire. So when Canadians are really in health trouble, serious trouble, they get the care that they need, and the care they get is actually excellent. Our health outcomes in Canada are very good. But when we're waiting for elective or planned care for surgeries or specialist appointments that are not emergent, that also has an impact on people's quality of life. And so we do need to fix it. And I go in the book into some detail about how we could, not by putting more money into the system, but by reorganizing the resources that we have, we could actually improve access quite significantly. It's more a question of thinking differently about what my job is as a doctor, what my patient's job is, and what we can do together to kind of move that forward.
A lot about keeping up with the times. Our healthcare system was created at a time when, the country looked very differently. Danielle Martin, thanks so much for being here today.
Thanks for having me.
If you're looking for more information, you can check out Better Now, 6 Big Ideas to Improve Healthcare for All Canadians. It is out in bookstores.